In the name of God, the Beneficent, the Merciful. A part of this session is about the reproductive system. Reproductive system divided into three parts: male and female, and a small part back to the perineal space. For introduction, I decided to have a review for the bony part of the pelvic. As you can see here, the pelvic bone consists of three parts: ilium, ischium, and pubic part. Here you can distinguish the borders of this bony part. The superior border made by iliac crest. The anterior border, as you can see here, consists of the ilium and pubic part, which here, and posterior border that made the greater and lesser sciatic notch located posteriorly, and inferior border made by ischio-pubic ramus, like this here, and the last border, medial border, that is very important at each side, made the inlet of the pelvic. I mean, above of this border, we can refer to the pelvic, false pelvic space, and below this line, we can refer to the true pelvic space. I turn up the pelvic bone to show you the outlet. In other hand, as I mentioned before, the inferior border made by ischio pubic ramus. They join to each other and made the inferior border. The space between right and left inferior border made the pelvic outlet. This is the coccyx, sacrum, and in real body, I mean not dissected person or dead person, the sacrum joined by sacrotuberous ligament to the tuberosity of the ischium on each side, I mean on the right and left side. The symphysis of pubic made the anterior end of this outlet, and the coccyx tip of the coccyx made the posterior end or tip of the outlet. Please have attention to this bony part, anterior side, anterior to left and right side that I show you. I mean ischiopubic ramus and sacrotuberous ligament. Imagine it's here on the left and right side. These bones, I mean each inferior border and symphysis of pubic to tip of the coccyx and ischioramus arc and sacrotuberous ligament on both sides made a triangle like this. Thus, this triangle show the perineal bony part. I mean, this triangle, make the bony part of perineum. We will discuss exactly in detail about the perineal space. But in this figure, The bony part of the perineum anteriorly made by ischiopubic ramus and sacrotuberous ligament posteriorly and anteriorly. Please have attention to this line. It's divide this diamond into two triangle, anterior triangle and posterior triangle. This anterior triangle is a site for genital and urinary system. And here, this triangle in posterior part of this diamond, here, this is the anal triangle. As we say to the anterior triangle, urogenital triangle. I'm sorry for my mistake about the diamond. I said at first triangle, but it's diamond. Again, we back to the perineum, the soft part of the perineum. As you can see here, the perineum is a space at the upper end of two thigh, I mean medial side of two thigh, under the pelvic, I mean here. As I told you, a diamond like this can be divided into two triangles, urogenital triangle and anal triangle because of the anus and because of the genital and urinary system. The ischiopubic ramus and sacrotuberous ligament, tip of the coccyx and symphysis of pubic made the borders and the axis of this triangle or diamond. Now in this picture, again we back to the bony part. I mean ischiopubic ramus. Sacrotuberous ligament is so clear here, and the outlet of the pelvic or perineal part we can see here. This should be the pelvic diaphragm, and as it clear here, you can find that the most anterior part of pelvic diaphragm is not filled by the pelvic diaphragm muscles. I mean, here exactly posterior than the symphysis of pubic, here there is a defect that it should fill by something else. So, pelvic diaphragm made by muscles that attach from the lateral side of the pelvic, and finally the right and left muscle fibers at midline reach to each other. At the defect part, urethra and vaginal or vaginal canal can be detected, and posterior than this, I mean in anal triangle, you can see the rectum that is going through the pelvic diaphragm and change to anal canal. In this figure, as you can see here, we have a look from the left side to the right half of the pelvic. It means it should be the medial border, and here this point here, this one here is a border between the greater sciatic notch and lesser sciatic notch. Lesser sciatic notch hidden by the pelvic diaphragm. It means if I remove these muscle fibers, I can directly reach to lesser sciatic notch. But this one is clear, and you can see the piriformis muscle going out through the greater sciatic notch. I would like mention you that the origin of pelvic diaphragm on the right side and left side that is removed are the same. I mean, it is started from the posterior of the pubic bone and cross the cross a line that joined the pubic bone, body of the pubic bone, to the ischial spine. This is the ischial spine, the border between the greater sciatic and lesser sciatic notch or incisura. Okay, so this line made by fascia of the abdomen that reach here and become thick and become an origin for the pelvic diaphragm. Now I try to show you the line of attachment or origin of a pelvic diaphragm to the inside of each side of pelvic bone. Symphysis of pubic, ischial spine, greater sciatic notch, lesser sciatic notch. It shows directly the attachment or origin of pelvic diaphragm to the lateral side. And as we expected here, this is the obturator foramen that's filled by membrane and internal obturator muscle. So attention, above of this line, I mean medial line, and the attachment of pelvic diaphragm, this space is true pelvic. And below this line of attachment, and till here, I mean the inferior border of pelvic, in pelvic bone, this should be the perineal space. In this figure, I try to show you the attachment of muscle fibers of pelvic diaphragm to the inside of the pelvic on the right side, and just I mean in a half, and it show the muscle fibers on the midline. This belong to the left right half, and of course we have the same in the left side. On left and right, both of them attach to each other in midline. Okay, and from here the rectum pierces the pelvic diaphragm and reach to the perineal space. It means under of this surface, these muscle fibers, till here the perineum space is here. And as you see here, anteriorly, the pelvic diaphragm is not completed. I mean, exactly posterior than the symphysis of pubic and pubic bone, muscle fibers of pelvic diaphragm not complete this space, and it should be filled by another muscle fibers that in near future I will introduce you as urogenital diaphragm. I think we had this figure before when we were in digestive system, and again I wanted to review this sagittal section through the abdomen. This is a symphysis pubic, and here you can check the ischium ischial spine, greater sciatic notch, lesser sciatic notch. It's mean it's belong to the hip, okay? And this line show the medial border, and this one is the inferior border, and this one is iliac crest. So these red lines show the muscles of the abdomen, anterior wall of the abdomen, and this red line show the attachment of pelvic diaphragm that it cross by rectum. When it pierces by rectum change to anal canal, and here urinary bladder located on the pelvic diaphragm, and this line on the anterior and posterior line show the prostate, and the urethra pierce the pelvic diaphragm and reach to the outside through these lines. Here, this line show the skin, umbilicus, and then reach to the penis, scrotum, and then here go back, made a hole for anal canal, and then continue with the posterior wall of the abdomen skin. Okay. These green lines that you see here, it show the superficial fascia, the membranous part of superficial fascia is scarpa. This is scarpa. In penis it made bulk, and here in scrotum made the dartus, and then in prene changed to Cole's fascia. Anterior, then the anal canal, it joined with the membrane or fascia, deep fascia that cover the inferior part of the pelvic diaphragm. It was a rule that each muscle sheet by deep fascia. Look here, this is the deep fascia that cover the muscles of anterior wall, and this line here above again is fascia, deep fascia, and here this one is fascia. But don't forget, in urogenital triangle, I mean here, this fascia has a special name, perineal membrane. So as you can see here, cols join the perineal membrane anterior than the anal canal. Don't forget, anterior than the anal canal, this space, we say urogenital triangle, and from here to this part, we say posterior, posterior triangle. I mean, it is the anal triangle, and in urogenital triangle, uh, from these fascia, the deep fascia that cover the upper part of the pelvic diaphragm, and to skin, here there are two perineal spaces, deep and superficial. Deep perineal space is a space that we called it pelvic diaphragm here. I mean, everything between this fascia that cover the upper part of pelvic diaphragm and perineal membrane, everything that we find here, we say they located in deep perineal space, and a space between perineal membrane and cols or skin is perineal space again, but superficial. Now here I would like to show you the real space. I mean, when we cut and remove the skin, here this part belong to the anal triangle, and you can see it filled by a lot of fat, and urogenital triangle that located inside the external genitalia, and this one show you the superficial fascia that cover the skin, I mean Cole's fascia, and here in this line it joins to the perianal membrane. Okay, and show you dartus and Bach here, and this line should be the attachment of Holden line to the fascia lata. When we cut or and remove all the superficial part, I mean external genitalia and the superficial fascia, we reach to the after crossing the superficial perineal space, we have access to the deep perineal space. I mean, this one is perineal membrane, as I'll show you before, and this one is the muscles at the mm, super in deep perineal fascia that made a cut and show you here, and as you can see here some elements goes through the perineal membrane, I mean pierce the perineal membrane and reach to the superficial perineal space. If you want to count these, one of them is at the midline, this urethra, okay, and in female we expected here we have vagina, and arteries and nerves that cross here, for example, urethral artery, this one, and ducts of a gland that is belong to the male reproductive system. I will show you this gland in deep perineal space are bulbourethral gland. So the duct of bulbourethral gland, the own bulbourethral gland located in the deep perineal space, but the ducts of them pierce the perineal membrane and reach to the superficial perineal space. So urethra, artery that supply the urethra and bulb, and this one is a duct, and here you can see an artery that is going to reach to the bulb, I mean the bulbar artery, and here near to the ischiopubic ramus, this one is deep artery of the penis, and here dorsal artery and dorsal nerve of penis is clear. This one is a vein of the penis that is going to join to the prostatic plexus. This one is superficial, uh, deep dorsal vein of penis. Deep dorsal vein of penis. Don't forget, it started from the penis and goes through this defect between this ligament is transverse perineal ligament, and the ligament that we have inferior of the symphysis pubic. Between these two, there is a gap. It goes through this gap and easily reach to the pelvic and joined by the prostatic plexus. Don't forget everything between this layer, perineal membrane, and fascia that cover the upper part of this diaphragm, we say deep perineal space. Now we discussed about the superficial perineal space and the elements that we have inside. Now it's better we back to a sagittal section through the pelvic in male. Penis is cutting from the midline and scrotum is clear here. Pelvic diaphragm, I mean the the part that fill the anterior wall of the pelvic diaphragm is clear here, and anal canal, rectum, urinary bladder, prostate, and urethra that cross this diaphragm and reach to the outside. The point is here that, as you can see here, the penis, the fascia bulk is here, and then reach to the scrotum, make the dartus, and here coles fascia. So all of the elements here between this diaphragm, I mean the perineal membrane here and coles, are in the superficial perineal space, and between this layer and superior layer we say in the perineal space. And this vein is the deep dorsal vein that is going to reach to the plexus of prostate, and as I said, it goes through the gap between symphysis pubic and this diaphragm.